what I'm going to share with you today is how do we help the clinicians listen to each other, but then also turn back around and make them into solutions. So this is just a very brief use of ThoughtExchange and clinical collaboration in a large hospital system. One of the things that we deal with our physicians and nurses is that they want to be heard. And so we have a lot of discussions, but sometimes those thoughts are not transferred over into a reportable, described method, and so it gets lost. And so let me walk you through how we used it. So I was sitting in church one day and the pastor said, congratulations, everybody. We have raised enough money to build a new church, and everybody was applauding. And then he goes, but the money is still in your bank account. So I thought about ThoughtExchange, and the thoughts and solutions are really still sometimes in our clinicians' minds, and they have not been shared in a forum for some reason. And so I always start our thought exchanges with our clinicians. We've had several town halls using the technology to say, there's a significant amount of clinical expertise attending this particular meeting. We have some phenomenal experts. We want to capture your ideas and your solutions, and we don't want to miss out on anything. And so, again, I always say it's still in your brain. It's just not recorded anywhere. Next slide, please. So a lot of times when we have clinicians come together, whether they're committees, councils, town halls, and things like that, we want to hear from them on key issues for driving successful care for our patients. Some of the problems when you bring them all together in whatever forum it is, whether it's Zoom or in a room, is that sometimes the loudest person gets the attention. Sometimes you have people bringing forward hidden agendas. Sometimes, depending on the culture of the hospital, seniority rules, and that's the only opinion that comes forward. Someone has to build the results from the next steps. That's usually quality and safety. We're bringing back and scribing what we think we have heard. And so I liked, Andy, your focus on listening is that sometimes when you listen, even in the best circumstances, you might have missed a very key point from someone who was talking in the room. Sometimes also, too, is once you go from sharing to actually scribing and bringing it forward, you lose momentum. And then also, too, what was very important is that because of the culture in the room or whatever hidden rules are there, is that it's not an anonymous system when you bring forward everybody. So that was some of the problems with just having a large group of people come together and share their ideas to be a solution for patients. Next slide, please. So in using ThoughtExchange, we wanted to share data at the system level and also at the hospital level. And sometimes we miss that, is that you'll have a system meeting, all of a sudden they'll see what Christus feels about, but then they really say, well, it's different in my hospital. We call them ministries. That's not us. And so when we did the ThoughtExchange in these large groups, there's over 100 people participating in our town halls across Christus of 26 hospitals. We were able to take the data and say, okay, I'm going to slice it at the Christus level, and here's your region and what you thought was appropriate. So you can come back and say, never say it's not us. It truly is us, and whether or not, they want to move forward on those solutions. So some of the pros of using that was it's anonymous, which was really popular with everybody, because you all know, and I all know, that when you sit in the meeting, there's somebody in the room who has not spoken up. So that was a very powerful thing. It also helped us share best practices amongst experts in hospitals. And so sometimes, you think everybody's talking to each other and they really are not. You want to also empower every team member to voice their thoughts and solutions. And so again, because the anonymous and also ease of the process, we had a good participation of everybody, and people thought it was great. And then last was using the data analytics to highlight the most supported solution strategies. And so again, it was very powerful that I didn't have to go back and create Excel spreadsheets and graphs. It automatically took it and gave it back to me so I could get it back out to the users to use. Next slide, please. So this is just a sample and how easy it was for us. And when you're putting these things together, we grabbed the QR code. It comes up on the screen. The first time we did it, we kind of held our breath saying, I hope everybody can do this. And bam, the dashboard lit up. So it meant that everybody understood it, loved it, and did it. We did also put the link in the chat box because some people like to use it on their computer, but very, very, very easy. And in 6 minutes, because we first started out longer than that, but 3 minutes to share your thoughts in an hour town hall, 3 minutes to rate them. And even then the clock takes a little bit longer than we think. We got a significant amount of feedback. So you want to have clinicians, because their time is so sensitive. You really want to capture them. They're busy out on the units trying to care for patients. So 6 minutes is good for that time frame. Next slide. So I love this slide. You can click to the end of 2 more clicks. Thank you, Andy. So this kind of tells me a little bit what ThoughtExchange did for us, is that you had your thoughts and ratings. All of a sudden there's a million pieces of information coming in. ThoughtExchange kind of looks at it and does some AI against it, and all of a sudden you have solutions and decisions that are based on themes. And so it pulls it together and organizes it for you very easily. And I love it when the computer does all the work for me. So I love this picture. It was like, yeah, that's it. That was what it did for me. Because I've lived in the world of flip charts, and you all go back and the flip charts sit in your office and they never, well, they do, but the transcription is very painful. Next slide. So this is just an example of what comes back out. So in this particular town hall, this is just an example. We had 65 participants, 102 thoughts, and 1,500 ratings, which means that nobody was doing another thing while they were listening to the presentation. They were actively involved. They also shared their opinion on whether or not they liked any of the solutions. And so it was very engaging of understanding what everybody in the room was trying to share, and then whether or not they supported it or not. Because sometimes you're in a meeting and everybody has a great idea and you get in the hallway and nobody wants to do it. And so that's not ideal. Next slide. This was very powerful. This automatically comes out of word cloud. And so this is great to show people. And, you know, there's ways to interpret the colors and the size and so on and so forth, but I didn't have to build this. This automatically comes from everybody who has put their thoughts into the program. So I love that. This is great to show people. Next slide. This also was very helpful. So here comes out all it automatically helps me. I had to do a little, I call it zhuzhing. The artificial intelligence does theming already for you. And sometimes I go in and go, well, I kind of know my hospital. I'm going to modify a theme. Very easy to do. But what it shows everybody in the room when I present this back out very quickly is that you see all the themes of how the thoughts came across, and they can see which were the most popular. Now, of course, what you're looking at right now is Christus system. It is not ministry, but they are given their ministry rankings. And so say, you know, share best practice is #1 in one of our hospital systems, you know, in the Southeast Texas, then they'll know that everybody there wants to focus on that first and not have a system opinion coming down to a hospital. Next slide. This one is very important, which comes out automatically once the ThoughtExchange is done, is that this tells you whether or not people thought those ideas were ranked high. Because you could have somebody share a thought and anonymously they could say, well, you know, the home health, you know, clinician, we're going to rate it like 1. So you'll know automatically whether at the system level or at the hospital level, whether or not an idea shared is truly got consensus by the entire group. So this is helpful because, as I said, sometimes you're in a meeting and politics plays and you're like, well, yeah, that's the idea, but nobody really supports it. And then it dies on the vine as soon as it heads out for patient care. Next slide. This is also very important. Again, this comes back out automatically from the episode of the sharing, and you can do it live on the screen. We kind of do it a week or 2 later because some clinicians couldn't come to our meeting, and so clinicians and nurses and other multidisciplinary. So we kept it open for a week and said, go on in and add some more if you want to. And so it allowed them, if they weren't able to attend, to continue to share the thoughts. But what you're seeing on the screen is the actual idea behind what the theme was. And so this one was discharge, phone calls, and navigation. A lot of people had some great solutions and they described it to people. And then also too, the whole group can see, well, this particular description was ranked very high by many, many people. And so it helps either a system level solution or it also helps a hospital level solution to put something forward. You know, how do we engage our nurses? How do we engage our clinicians? And so what I take away from this is that this is truly active listening, and then it leads into solutions, because sometimes you'll come away from a meeting and everybody has heard the ideas, they just can't recall whether or not everybody supported them or what did it really mean. And so this has helped us take information back quickly to say, this is what you all believe in. We've helped you prioritize it. You've told us what's a priority. And then a part of the ThoughtExchange, we have a couple slides before that are key experts who are sharing best practice. And so it's not just rate of your solutions. We have people who have already tried some of these things, and they also show the success. And thank you so much for inviting me to share on what we've done to engage clinicians to listen to each other better.